We're talking about COVID-19, and we know after a year how it is affecting so many systems within the body, but we're going to focus on the lungs for the next couple of minutes. I'm going to introduce you now to an emergency room physician in Toronto who is raising the alarm about the effect that it's having on lungs, and particularly striking is that he's doing it with the pictures of people's lungs to highlight the brutal impact the disease has on them. So let me introduce you to our guest, Kashif Pirzada, who, as I said, an emergency room physician in Toronto. Good morning. Nice to see you this morning, doctor.
Good morning, Heather. Thank you.
I'm really looking forward to this because I think this is going to really illustrate for so many people what's happening in the lungs. I want to bring up, and I know you can see from where you are, let's show, first of all, a healthy lung. And tell me well, there's a lot of black. It's pretty clear, I guess, isn't it?
Yeah, it's very clear. You can see the heart in the middle, and the black around the heart is the lungs, and that's a healthy lung. The x-rays pass right through it, and it looks black.
That's what you want to see. That's what you want it to look at. Okay, we have a series of 3 side-by-sides. I'm going to bring one up first of all. This is a 35-year-old patient. Tell me what you see there.
So you can see that there's the heart in the middle, and then around there's big splotches of white. So that's lung with fluid in it. This is basically pneumonia and viral pneumonia from COVID. And this person basically is almost drowning in fluid, and they're not exchanging gas, and their oxygen levels are very low. And this person was only in their mid-30s, but if I had to look at this X-ray and I didn't know their age, this looks like an X-ray of someone much older, in their 70s or 80s.
So that white, that represents fluid in the lungs. And you said, because you gave me some details about this, the oxygen saturation in this patient is 65%. What would it normally be?
Oh, in a young, healthy person, 100%, 95 to 100%. So they were critically ill. They needed oxygen therapy, and they're still in our ICU right now, actually.
Okay. Keep going with this. We have a 30-year-old patient now. This is a man. Here's our second slide. Again, look at this and tell us what we're seeing in this one.
So same thing. You're seeing sort of a haze and white all over the chest, beside the heart on both sides. And again, this is fluid in the lung. It's viral pneumonia, and this person was also fairly ill. They were admitted for something else to the hospital. Then overnight, they had trouble breathing. And they did an X-ray and discovered this. They didn't even know they had COVID.
Really? That's incredible. So they'd be labored breathing, and then obviously so many patients end up having to be intubated and assisted in their breathing. Is this as a result, doctor, of the variants, or is this the original strain?
I know for sure the first image we saw was the UK variant. And we know from experience in the UK and Europe that it's hitting younger people harder and faster. So that's the experience I wanted to share, and that's why, with patient permission, we shared this on Twitter just to raise awareness of this.
Yes. I want to come back to that point. I definitely think we want to spend some more time there, but I do want to show one more side-by-side slide. So this is a patient who's a 48-year-old man. Again, let's look at that. Again, we see all of that white in the lungs, so all of that fluid. And if you could, again, is there anything distinctive about this, or it's similar to what we've seen?
It's similar, and if what happens with these patients is that they're not in for a quick recovery. Like it's going to be if they leave the ICU, they're going to need months of rehabilitation and therapy, and that's what these people are facing. And that's not something any one of your viewers should want to go through. That's why we put this up. Like, try to avoid this illness at all costs, because
yes,
if these people survive the ICU, they're in for a very long recovery with many of their organs being damaged.
If they survive is a question. And then we're talking about prognosis. We're talking a lot, doctor, about long haulers as they've become known. Is that damage? Is it permanent?
We don't know a lot about long haulers, but we do know maybe 10 to 15% of everyone who gets COVID is going to have some form of long-term symptoms. And we don't know how to treat them. So this person, these people may have scarring in their lungs. Other people get fatigue or memory problems. And again, like, no one knows what to do with them because it's a brand new illness. And, we've seen illnesses like this before, like chronic fatigue syndrome and fibromyalgia.
Yes.
And if there's one thing your viewers should understand is that you don't want a condition in which doctors have no idea what they're doing, have no idea what to treat. And so avoid this as much as possible, as much as you can.
That's such an important message. And again, for younger people watching, because all of the information that we're getting right now is at 59 and under, but particularly 20 to 29, and they're younger and they're sicker. And this is a really sort of where we are, it seems, in the progression of this pandemic.
Exactly. You know, I think personally, I think a lockdown is coming. But let's make this the last lockdown, because you know there's no vaccine for children. We're going to have another wave in the fall when kids go back to school, and you don't want to see kids show up with X-rays like this. You don't want them to get sick like this, and we know they'll also get long COVID too. So let's do everything we can to make sure this wave is the last one. Do things to prevent transmission. Learn from places like Newfoundland and Halifax and Nova Scotia, and just really work hard and make this COVID history, hopefully.
You know, I struck just a quick little family anecdote. My husband showed his father once, who was a smoker at the time, what healthy lung tissue looks like and what blackened lung tissue looks like in a regular smoker. And his father looked at that slide, the two slides side by side as we've just done, and he never smoked again. Quick, told cold turkey right away. It was very effective, that strong visual image. And what you're doing strikes me that, you know, it could potentially have a similar effect.
I hope so. Like, I think I've even heard anecdotally from patients that, you know, the message is getting out there. People are being careful. And remember, vaccinations are really kicking into overdrive. You know, in Ontario, at least, we're hitting records every day now. And really, most people are 2 months away from getting a shot, and then you'll be protected. So really hold fast for a couple months, you know, postpone any big plans you have. It's not that far away that you can do these things safely. So just give a couple months of patience, and your patients will be rewarded, hopefully.
And avoid what you've just shown us so vividly this morning. Dr. Pirzada, thank you very much. I really appreciate the conversation today.
Thank you, Heather.